Hi, I'm Dr. Geetha Gandluru, a consultant child and adolescent psychiatrist. I work in Harley Street with Harley Mind Care and also a full-time consultant with NELFT, Northeast London Foundation Trust. Today, I'd like to talk to you about PTSD, which stands for post-traumatic stress disorder in children. Now, PTSD, general public might have heard it more commonly in adults, but in my clinical practice, I see a lot of children and young people who present with post-traumatic stress disorder, but actually presenting with difficulties associated with more like depression and anxiety. It's not always evident that it is PTSD unless we actually take a very detailed history. Now, in children and young people, the trauma does not have to be as significant or as severe as we would think or to be considered in adults. It could be an incident that a child has encountered which to them was pretty significant, but has never been addressed. And children with PTSD don't always present at the time of the trauma. It can happen way later, and they don't always relive the past experience in the form of dreams or flashbacks. But often we see children enacting the traumatic experience through play and peer interactions and other day-to-day activities. Equally, children and young people with PTSD can present as hyperactive, agitated and aggressive, and often can be misdiagnosed as ADHD. But actually, we need to get the full story to be able to identify PTSD and the timeline, the correlation with the traumatic experience and onset of symptoms. And PTSD is again diagnosed with a very comprehensive clinical assessment with collateral information from caregivers, from schools, and the young person themselves. And if need be, we also have a structured or semi-structured standardized questionnaire to understand the impact of the event, which is, again, the scale is called Impact of Event Scale, which identifies the severity of the symptoms. And the main treatment for PTSD is psychological treatment. It could be either CBT based, which is trauma-focused CBT, or a more kind of shorter and novel treatment called EMDR, which stands for eye movement desensitization and reprocessing, which is found to be very effective in dealing with trauma in children. And EMDR also is very effective in children and young people who struggle with talking therapies. So that's kind of got very good evidence base.